Hi, my name's Nigel. I've got a background as an occupational therapist, and I'm the clinical lead for Perci. So the team at Perci have asked me just to put together a short video to help when you're asking for consent, when you're doing phone calls or having meetings with clients. So probably the first thing as a clinician, and I'm sure you've read the information, but you can have confidence in the product that Perci is fully compliant with all Australian health legislation. So all the data is stored within Australia. So you need to have confidence in the tool that you're using. And it's unusual that we get nervous because we're always asking for consent when we catch up with the client, getting them to complete documentation or fill out a consent form before we start the process with them, doing the assessment or engaging in treatment. Normally what I do, whether I'm making a phone call or having a meeting, once I've done the introduction as to why I'm there or why I'm calling, I'll just let them know. So it might go something along the lines of this: "G'day, it's Nigel. I'm calling just to talk about how things are going, and also discuss the outcomes regarding treatment. By the way, I also use a scribe called Perci, which summarizes our phone call into case notes, which makes things easier for you and I. And normally the person will go, yep, that's fine, no problem at all. And I've only probably had one or two people who've said that they don't want to use that. And when that is the case, all you need to do with Perci is you just basically press the stop button here. And then you can just continue the conversation or meeting as normal. But you just need to find something that works for you. So if you're comfortable describing the benefits of Perci and talking about while you're making that recording, while you're using Perci, then the person will be more than happy to look at using it. And a couple of tips I will occasionally offer to show the person the summarization after we finish, so it gives them the confidence. And I also might occasionally talk about why I use it if they are. So I talk about the fact that it provides that information to me straight away, that I can action those things that we talked about in that meeting or that phone call. And also because it helps me be more engaged with their conversation so I can listen a little bit better. But most of all, you need to find something that works for you. So there's scripts there for you to use as well on the Perci site. But if you've got any questions, reach out to the team or myself directly, and happy to help. Best of luck.